Really interesting headlines across different papers. But I have with me a lawyer and public affairs analyst, Jide Olokun, as well as Dr. Dane Kere of the University of Lagos. Gentlemen, good morning.
Thank you.
Nice
good
to
morning.
see you. Yeah. All right. Let's begin with the Vanguard newspaper this morning. Vanguard is where we're starting from. Free web operators threaten national security. An expert is saying that, and conference participants list dangers to Nigeria by over-the-top OTT operators as expert stakeholders call for urgent strict regulation of OTTs. Okay, you want to know how? Grab a copy and know what it is saying there. Now, Blueprint is reporting the federal government on the 9th Assembly. We won't work at cross purposes. The Senate shift 8.83 trillion naira 2019 budget passage to Tuesday, and protesters demand open balloting for principal officers. From the Blueprint, let's go to Daily Trust. NMA fumes as Ngige says Nigeria has surplus doctors, and it has really generated a lot of controversy across Nigeria right now since this statement was made. We'll be talking about that shortly. From Daily Trust, let's go now to This Day. AMCON by Courtney Baker over Supreme Court judgment. The controversy still lingers, but the Supreme Court has put an end to it, but still generating ripples there. Now, from there, let's go to The Nation. The Nation newspaper is the last one we're looking at this morning. Buhari will improve lives with high-impact facilities. And the President hails Ambode. We used our resources well, says Governor. We recall that the President was in Lagos yesterday to commission some facility and projects carried out by the Lagos State Governor. All right, gentlemen, let's go into this controversy, the statement by the Minister of Labour, Dr. Chris Ngige, who says that Nigeria has enough doctors. I like the way Daily Trust breaks it down. He has this WHO benchmark is 1 doctor to 600 patients. In the UK, there's 1 doctor. They have 1 doctor to 337 patients. In South Africa, they have 1 doctor to 1,250 doctors. Then in Nigeria, it is 1 doctor to 5,000 patients. And we have enough doctors. I'd like to start with you, Jide.
Yeah, Dr. Ngige, he's a doctor himself, has spoken, and he has gotten the response. And I'm not surprised. You know, he's not within.
You're not surprised at the statement he made?
Yes, given the antecedents of the high and mighty in Nigeria, he's not within the bracket of those who really need local medical attention. They have access to traveling abroad for their medical attention, and for some of them, they have even invested abroad for, you know, medical facilities. But whether we like it or not, the global benchmark is there. And if you look at some of the statistics we have in this country, for example, recently we have been described as, I think, second worst case of open defecation, you know, worst case in child malnutrition. We
child
have
mortality.
a maternal mortality crisis and issues like that. And if you look at the attention that has been paid to the health sector of the economy of the country, you should not be surprised. But I hope that someday leaders who really care about the people will rise up and take responsibility and not just go into office to enjoy the paraphernalia of office at the expense of you know, the welfare of the people.
All right.
It's a good revelation, really.
Okay. Dr. Kere, I wonder, when you read this or when you heard this, I wonder what went through your mind. How insensitive would this statement be if you have to analyze it from any window?
Thank you. Really, I didn't see anything strange in that because...
You're not surprised as well?
Certainly no. It's a reflection of the kind of leadership we've always had over time. You know, people who are so removed from the realities on the ground, so detached from the people they claim to be leading, how they lead. I don't know if we have started operating e-leadership. I really don't understand. You know, for a medical doctor, former governor, now Minister of Labour, to make such an assertion, all we should have, expected him to put forward is the statistics. What is the total number of doctors in the country? And what is the population you know, and when you do the alignment, then you'll be
In
able
fact,
to
from
tell
the
us,
revelation on the
you
Daily
know,
Trust here, it says they have about 45,000 practicing doctors in Nigeria.
Oh, and sometimes too, the few that are very good, Ngige would have cornered one that will give him the first, you know, yeah, the first advice to fly abroad. President will have his own. So at the time, all those big names keep these ones to themselves. Who are the, go to the general hospital. That is where you know whether we have enough doctors. You will find, in fact, sometime you will get there as early as 6 a.m. You will not be attended to until about 10, thereabout. Because there are few hands attending to so many people. And as a matter of fact, somebody, you know, a professor of medicine has what to, because I was asking the man, how come you find people in very critical conditions, rush to your hospital, and you seem not to be, you know, caring about them.
You're not moved.
Yeah. The man said you look at the number of cases you are going to address, and you look at the personnel you have. So you look at which one is most critical. If I attend to this one is almost at the departure hall. At the time you waste all the energy on this one.
How do you mean by departure hall?
You know, so those are the challenges you have. Somebody, maybe in an accident situation, somebody who is in a very critical condition. You look at 10 of them, okay, if I spend all the energy on this one, there are still chances that he will die. Why not attend to the ones that I can save? And not, so if we have enough, we will have that kind of a challenge. And as a matter of fact, even if we have the few that we have now, the facilities are equally very challenging. Because if we have all the qualified, you know, we have hands, but the facility, if they were here, President would not spend how many...
We have reports and the records that Nigerian doctors are going, in fact, in droves to other countries, especially the UK and the United States. And right now, the destination now that most of them like to go to is Canada. And some of these countries know that the quality of people coming from Nigeria is up there. They just have to just get familiar with whatever environment they practice and all of that. Now, if we look at the budget for health, the ministry or the health sector, it has been hovering on the average of 5% over the past a few years and all of that. And the benchmark for the African Union benchmark is 15% of the budget. Yeah. I wonder how troubling this is, or how far away from getting it right we are, Jide.
Yeah, you know, it's so sad. And I think the concern of the Honorable Minister is that these doctors can go if they want to go. After all, they go out there, they make money and repatriate the money and stuff like that. And he is not bothered about the brain drain. The fact that we train professionals here and we cannot retain them within the system. And organized countries drain them out of our own system, and we suffer for it. And I just want to advise Dr. Ngige to probably, if he has the time, go and study what John Magufuli did in Tanzania. And of course, we are addressing our president and commander-in-chief. In the week the man took over as president, he visited one of the state hospitals, sacked the leader of the hospital, he met people sleeping on the floor, and he diverted funds to revive the functionalities of the hospitals. And today, if you know the health rating in Tanzania, so we are talking about leaders who are in touch with the people. But here we are. Like we said, they have several alternatives. I mean, are you surprised that in this country, a governor built a so-called world-class hospital that he boasted could compare with any teaching hospital? And when he had an accident, he flew abroad for treatment. And as we speak today, that hospital has shut down. So I think it's one of the revelations we need in Nigeria to really qualify the level of leadership we have.
All right,
now.
We have to leave it here now, but it's quite troubling that any government official will even make that kind of statement. On the papers yesterday,
of them.
No, but the point there is that whether it is characteristic of them, it is still troubling in the kind of leadership we have. Because the point there is, we have on the papers yesterday, we was revealed at the CMD of ATBU TH, that's in Bauchi, the teaching hospital, was revealing that they have patients on the floor everywhere and so on.
But the man is just being careless about the situation.
All right, let's leave it here for now. Thank you very much, Dr. Dan.